All right, doctor. With the Refit Eye and the Refit Face product, as we know, they're very rich with biogrowth and the peptide. Would you please share with us why peptides are important for the skincare? And a lot of questions we've been asked, at what age should I start?
That's a good question. So here's a couple things for you guys. Is the most important regenerative products for the skin are stem cells, biogrowth factors, and peptides. They work specifically to do many different things, and they're going into the cells and they're stimulating those cells to do different pathways. Most products that carry biogrowth factors or peptides are used for anti-aging. They're used for healing, post-procedural protocols, like after you've done a facial or derma rolling, you've done laser. That's the key time to be using them. Now, even people in their 20s, they're starting to get sun damage. They're starting to notice signs of aging, like under eye circles and fine wrinkles. That's when you'd want to start using the product. Although I will say biogrowth factor peptides and stem cell products, those are middle age in general for anti-aging. But nowadays, in our time period versus 10 to 15 years ago, when I was starting with skincare, people in their 20s weren't doing things until they noticed something on their skin. Nowadays, people are doing it preventatively. So if you want a key product that's going to be anti-aging, also help you heal with all your post-treatments, then you want to go with the biogrowth factor and peptides. Now, originally, the original product, Refit Eye and Face, were just biogrowth factor and peptides and 1 or 2 active ingredients. They have been reformulated, and our patients are saying significant improvements. That's actually why the Refit Eye specifically, we're using post-CO2 laser or erbium resurfacing or plasma pen. It has in it a couple other things that are added. I don't know if you know about chrysin and dipeptide 2. Those are to decrease dark circles. Jojoba's in there, which is a product in which is an ingredient in multiple facets of our line for intense hydration, so you don't have as much puffiness, and also protects the skin barrier. You know, a lot of people get eczema around the eye, they get irritation, especially when they're traveling, those types of things. Licorice root added to the product, that decreases pigmentation and also inflammation. So when you're getting these treatments done around the eye, whether it be microneedling radiofrequency, peels, laser, that's going to help it heal much more quickly. One of the things people don't think about a lot in eye products is having an exfoliator. And it's actually really important to turn the skin cells over faster so you get more collagen production, and it allows the peptides to get into the skin, producing, improving fine wrinkles, producing collagen, increasing the cell turnover more quickly. So we added in there a little bit of salicylic acid. That's one of the things that wasn't in there before. And normally you'd think salicylic acid as a acne product, but it is a basic exfoliator, and it's a calming agent. It's made from willow bark extract, which basically is like Tylenol and aspirin. It acts like it to calm the skin down. We also added prickly pear in there. Some people call it Botanical ficus indica or prickly pear. It's an antioxidant. We added other antioxidants like milk thistle, and then we intensely hydrated it with hyaluronic acid. So you have a lot more of an active hydrator, a biostimulator for collagen production. You have in it barrier protection and calming, all in Refit Eye, which is why it got ophthalmological tested approved, which means you can use it around the eye when people have contacts, when you're doing laser treatments. A lot of products are not ophthalmologically tested and approved. So that's one of the things that Refit Eye is really important for. So people at a younger age, even if they're not doing these treatments, but they want to prevent dark circles, they want to keep the fine lines from forming, they want that area to be smoother, they're going to want to start Refit Eye earlier. I use it twice a day. There's no limitation on the amount you can use. Remember, all the products, everything in this product is anti-inflammatory. You have in it antioxidants like the prickly pear, you have the milk thistle as an antioxidant, you have barrier repair with hyaluronic acid, you have barrier repair with the jojoba seed oil, and then you have all your peptides in there. You have your tripeptide 1, tetrapeptide 7 and 9, dipeptide 2. So all of these are doing different things with collagen production, firmness, elasticity. The reason we don't have all of that in the Refit face is because it would be very expensive. The product would be so expensive, you'd never be able to do it. So around the eye and the sensitive, thin-skinned areas, we can really compact it with a significant amount of active ingredients that is allow the eye area to look better more quickly. Now with Refit Face, this to me is, I mean, this was our #1 selling product from the beginning.
Yes.
People combine this with everything. The reason I didn't make, and we talked about this before, a daily moisturizer, which we're gonna make in the future for people that have more mature skin, maybe they're healing from a stronger laser, they want something a little thicker, a thicker barrier, or they live in a cooler environment and they get more dehydrated more quickly, something that's a little more occlusive. This is a breathable cream, meaning it's almost acts like a lotion, but it's actually a cream. It does have in there a lot of similar peptides to Refit Eye, the tripeptide 1, the tetrapeptide 7, tripeptide 38, which actually helps more in wound healing. That's not in Refit Eye and is very important, is why I have this as a daily peptide anti-aging product, but can be used at high concentration as much as you want. When you're doing a laser treatment, microneedling, plasma pen, etc., you will heal much more quickly. That's why it's our go-to treatment as a hydrator combined with hyaluronic acid. So Hila B is what you would mix it with to get even more hydration.
Yes.
Go ahead.
No, yeah, yes. I said, I just want to add one thing. I heard you one time talking, and I think it's a point of difference for our product than any other place. I heard you talking to one of your patients, and you talked about how the Refit face help with the laxity of the face, because a lot of cosmetic surgeons, when they talk about lifting, they say, oh, you don't have the laxity. So to start with that.
Well, this is why I was talking about the peptides. Most of these peptides, the function of them is to hyper-stimulate collagen production. Now, in Refit Face, which has tripeptide 38, which also helps in wound healing, you know, the neck area specifically, it gets a lot lax more quickly than the face. And you need that tissue repair. You need collagen production for firmness and elasticity. So the combination of Refit Face and Hila A, or the Illuminating mask, which I use about 2 or 3 times a week because it's an enhanced retinol peel basically, but you can use it as a retinol product. It's very strong, gives you a lot more tightening to the face. That is also why after any tightening procedure, ultherapy, microneedling, radiofrequency, threads, we combine Refit Face and retinol and Hila B for hyaluronic acid for hydration. So any treatment that somebody does that's a lifting procedure, they should be getting that done. Elicor, that's what we use. That's why people heal more quickly. Also the fact that Refit Face, again, just like Refit Eye, we added the licorice root, which improves the skin tone and inflammation. So redness that you typically would get from these laser treatments, the micro coring, derma rolling, etc., goes away more quickly. And people that have more sensitive skin tones or mixed ethnicities where they have pigmentation, it decreases that pigmentation. So, and then also the hyaluronic acid is in there, which also helps elasticity, because not only is it plumping the skin, which again goes very deep, the hyaluronic acid can go much deeper than most hydrators can, and it's a key functioning product in the dermis that we need, but it also protects against environmental damage. It has some antioxidant capacity. If you want, with Refit Face, you should be combining with AOC, because you will get, again, the full anti-aging with collagen production, but also enhanced hydration and antioxidant effect from AOC. And remember, hold on one second, with the other thing I wanted to say was we also added one other ingredient that's really important. That's a very strong antioxidant. It's a type of algae that's very rich in beta carotene. And so that helps also the healing process. Now, one of the things that we also did was, remember I talked to you guys about the prickly pear being an antioxidant in Refit Face and Eye. We also added it to AOC. So AOC before was just vitamin C and blueberry. Now it has coenzyme Q10, which is another free radical. Again, antioxidant, helps against reversing sun damage. That's why typically you use the Oxy in the morning, because it's going to protect you if you go out in the sun, obviously with your sun protection, but you get more antioxidant effect. Adding the prickly pear gives more moisturizing, more anti-inflammatory effect, and more smoothing effect. So technically, you know, Refit Face, Aoxy, and Hila B can all kind of be used together. And to be honest, I do them all twice a day. Most people, they're doing a hyaluronic twice a day, so like Hila B twice a day. They're doing their anti-aging peptides usually at night because it's more collagen production. So they're doing that with the retinol. So you're combining them with Hila A or the Illuminating mask. And most are doing their antioxidants in the morning. So that would be your Aoxy. But there's no harm in doing them twice a day. In fact, for the majority of our post-care protocols, you are doing it twice a day. If you don't want to use every product twice a day, then you use an enhancer. And that's where the Botanical serum comes in. The Botanical serum was made to be used as an enhancer to all of these products. So if you don't want to be using them all twice a day, you then can add the enhancing serum to use twice a day. And again, the interesting thing on that product, and I don't know what you've been hearing from people on it, it has a combination botanical calming system of multiple botanicals to help reduce inflammation and get rid of redness. So post-procedural, this is really good. People who get red in the sun, you just want to do anti-aging. There's a strong antioxidant effect to it because of the green tea polyphenols that are in there. And again, it has some salicylic acid. So it's promoting that cellular renewal, the turnover, decreased in inflammation. It has the same vitamin C that's in our Aoxy. So again, at a lower concentration, but extra antioxidant effect. So it's booster. So this is your booster. You know, it's green because of the chlorophyll that's in there, which helps with more with acne and blemishes. But the biggest effect, I think, besides the calming, botanical calming system and the green tea, with the fact that you have the willow bark to push everything in more quickly, is that it has melatonin. And the melatonin is used to calm and soothe the skin. It calms it down, and it actually helps prevent more UV damage. So again, another product you can use twice a day, especially when you're doing treatments, or let's say you go in for a microneedling, maybe for a couple days after that, you're using these products twice a day. But then if you want to cut it down a little bit, whether it's cost or you don't feel you need it, you could do the Botanical Enhancing Serum in the morning with Aoxy. But the key is you have at least using those peptides and your peptide serums at night with your retinol, your antioxidants in the morning, and your hydrators like a hyaluronic acid, Hila B, twice a day, because you want to keep that barrier really fresh.
I just want to comment on this. Actually, there is a soccer coach who recommended for the team to have the botanical serum, because when they play out in the sun, they're like in the 15, 16, it's fantastic for them to calm their skin. They put it on the back of their arm. And I know this is like healing and great. One thing I learned today extra is the salicylic acid is also a calming agent. So thank you for saying that.
So just so you know, willow bark extract in the old days, the indigenous people knew they would chew on it and it would decrease their joint pain. So people knew that it acts like aspirin. It had the effect of being anti-inflammatory. Now at high levels, very strong amounts, you can get a lot of exfoliation. That's why it can be used as acne peels or as a peel that somebody does in the office. But in general, it's a cooling peel. Most people with that on Accutane or that have bad rosacea, they can do salicylic acid peels, even up to 30, 40, 50%. I used to do them when I was a fellow. You would see the crystallization on the skin. Now what we do is at a lower concentration, you get that calming effect on the skin, but you get the exfoliation that allows products to penetrate more. How can we get products to get into the skin better nowadays? There's a couple ways. One, you can thin the stratum corneum, the upper surface of dead skin cells. How do you do that? By physical or chemical exfoliation, okay? Physical is microstamping or doing scrubs, We have our toning pads. That's why I like people to use them, because the morning ones have the vitamins and the antioxidants, and the nighttime ones, which is why I'm a little red, because I've been using the glycolic for 4 days in a row.
Yes.
It acts as a micro peel. So you get a good result. Your skin is super smooth. Or you can do use products that turn the skin cells over. So your skin is constantly micro peeling. You may not see it. That's where the retinol comes in. That's why I love the illuminating mask, because yeah, you could do it once a week and get that and speed it up, but you could do it even more than that. If you have dark circles, you're getting ready for a wedding, you want to look good, do that every day for a week. You know, it'll improve it because it's getting rid of those dead skin cells. The other option is add in a
Hila A.
beta hydroxy acid, like a salicylic acid. So that's why I know it sounds, most acne products, they're very high strength salicylic acid and alcohol, or typically like an astringent. That's because they want to get rid of oil. We're not trying to do that here. We're trying to turn the skin cells over in a cooling, calming fashion. That's also why post laser, it works really well, because it actually calms the skin. And imagine when you have plasma pen around the eye, you have all these little dots, you need those guys to exfoliate. The exfoliation of that helps prevent the problem. And that's where having that combination of that in there really helps. That's why we added it at low levels to the majority of these products, so that it enhances the overall outcome, which when you see, I don't know if you've seen a lot of the before and afters, but even in a week, people's skin change. And you don't normally hear that from most skincare products.
No, and the other great thing, doctor, which probably will be my second question, is the love that everyone have for the Hila A. When you talk in general about anything with retinol, the very first thing comes to your mind, oh, I'm gonna peel, I'm gonna have a flakiness. How come this Hila A with the 0.5 retinol is that gentle on the skin?
That's a really good question. I mean, here's the thing I always tell people, look, the illuminating mask has even more than that, and it's still gentle.
Yes.
All of it always has to do with the key delivery system, okay?
Yeah.
The delivery system has to be calming, hydrating, and barrier protection. So in the illuminating mask, you actually have marine sea whip extract, and that acts significantly to reduce redness and inflammation, but it doesn't get rid of the results. So you have your exfoliators in the illuminating mask, which are your TCA, lactic acid, salicylic acid, and retinol. Those all should make the skin look really red, irritated, but because it's in a hydrating base with the marine sea whip, you don't get that. Also, because the brightening agents in the illuminating mask are extremely high concentration, arbutin, niacinamide, kojic acid, and vitamin C. All of them work as alternatives to calming the skin and reducing pigment, redness, and inflammation. So you have your exfoliating component at the initial ingredients, the brightening component, and then you have your hydration in the actual product itself and the marine sea whip. So that's why you don't get, now if you did it every day, because it is much higher concentrations, if you did that every single day for, you know, a week, I do that frequently, you will get a little red. You may get a little
been looking great
slightly, but it's not going to be deep peeling.
No.
It's not going to be irritating like people get when they use a strong retinol that's irritating. The reason those retinols that are very irritating are because they're typically in a non-hydrating base that delivers the retinol immediately rather than over time. So in our retinol, it's actually slower releasing given the base that it has, and also the licorice root that's in there is anti-inflammatory, so it calms the skin down.
Perfect. And I know this is really point of difference, the time release of the ingredient. And I remember last week on the previous conversation, you did mention that even there is other product that have the same ingredient, you did say it's the secret where the percentage of those little ingredients, how they are mixed together, it's all about the soup. You can take that recipe, but you never know how to mix it. And this is why our products are different.
Yeah, and here's the thing. It does have jojoba seed oil, again, which is an intense hydrator and a barrier protection. So it's
Correct.
almost like an encapsulated product. You know, the retinol is our slow releasing. It's the all trans. You have your jojoba, you have your licorice root for anti-inflammatory, and you have a hyaluronic acid. So all of that is a super hydrating anti-inflammatory retinol. This is actually why I use it even twice a day. And I have people that use this immediately after laser because it
Yeah.
actually speeds up the turnover of the skin cell. Now, some people get a little nervous about it in a CO2. I have no issues with it, but if they were, I would tell them to wait then and do it
3 days.
right when they peel, right when they're peeled. The illuminating mask would be the alternative that they would do the day of, day 3 and day 7, and then weekly after that.
Correct. Since we're talking about all of the exfoliation, and after all, we all want this brightness in the skin. So would you just share with us with the high spot?
Yes, my
And
favorite product that I've
yes,
just
so I have a few questions on this one that's I've been asked. With this product, if I mix it with the Hila A, would it be I'm concentrating my treatment on a brightness? Can I use it during the day? Also, when you're talking about it, tell me how it is different from the AOC serum, because we also know that serum give me brightness to the skin. Just give me the point of difference on those three
Yeah, I mean,
products.
here's the thing. You have to think of this product not as a highly concentrated individual ingredient. This is a complex mixture of multiple extracts to brighten the skin. The
Right.
blend of these extracts will visibly change the look of the skin, and it equates to using something like a hydroquinone or retinol and hydroquinone. Now, I tell people this is a twice a day product, one for anti-aging and brightening, or anyone that just wants that, or anyone that has pigmentation, whether you have melasma, you're
Oh,
Indian and you have blemishes, a little bit of dark circles, any pigment you want the complexion to be more blended and even, more radiant without having to use hydroquinone, a higher concentration of antioxidants on your skin to calm the skin down. This is great for those that are acne prone. This is great for those that even have acne or on Accutane and are on a lot of irritating acne products. This will calm it down a little bit because there is the vitamin C in here. But again, the vitamin C is not as concentrated as AOC. So if somebody's using AOC in the morning and they like getting that antioxidant effect and brightening, this will make it boosted. It will be even better. It's again, you have to think of the Botanical serum as more calming
yes.
as a booster, and you have to think of the high spot as more brightening as a booster. So they're using these, yes, they both have vitamin C, but this is going to actually visibly remove blemishes, pigmentation, melasma. This also has in it a little bit of peptide. It also has green tea. What does that remind you of? Our Refit products. So
Correct.
all of this combines. High spot to me is a daily, twice a day product. But if somebody only wants to use it, they could use it morning or night. It doesn't really matter, but it does have a big antioxidant effect. So it might be better to use it in the morning, or you could use it as spot treatment for areas of pigmentation as needed. There is a blueberry extract in here similar to our other products that helps to firm the skin. So this is an anti-aging product as well because it does have the peptides. And that's why I call it the go-to anti-aging brightening complex.
Fantastic. Great. I want to talk to you about the Enzymatic alpha hydroxy pad, because every time I'm talking to an account, they're ordering 20 and 30 of these. It seems it's like to go to. I mean, with 15% glycolic acid, everyone loves this product. Now, here's what I wanted to know. Knowing some people are in their mind, oh, I'm sensitive to use the 15% glycolic and use Hila A at the same time. Can they be used together? I know they are designed all that product. I wouldn't recommend mixing something else, but can those two be used?
Yeah, I mean, look, this is like your weekly peels, right? This is like an at-home peel. This is great when people have blemishes. This is really good on the body, on the arms, on the chest, neck. I use this every day now, and I do Hila A every day. So yes, you can. And actually, when you use this, it allows the Hila A to get into the skin better. And perform better, because again, this is one of the enzymatic ways to get rid of that natural thick layer on the surface, the stratum corneum. So this is exfoliating.
Correct.
Thing about it is it has other acids. It doesn't just have glycolic. It has lactic, tartaric, citric. They all work for pore cleansing. They all work for cell renewal. It also has papaya. So papaya enzyme that's in this is just like enzymatic polish, okay? And that's why when you're using the pads, you should be using the polish. That's what I always tell people. So you're getting a lot of other things in there. Now, the other interesting thing too, just so you know, is it has encapsulated antioxidants in it. It has vitamin A, C, E, coenzyme Q10, which is anti-inflammatory. It also has retinol palmitate. So this is like a retinol peel. I mean, it's almost like doing a pad to uncongest all the pores, but push products in. I tell people you cleanse with the enzymatic, you wash with you then tone with this, then whatever products you put on the skin are going to penetrate more.
I know some clients are using it on the back of their hands
Yeah,
and
it works
on
great
the elbow because it's great to give you that useful skin. But a quick question on people who are having the laser treatment. Now, if I got the laser treatment number 1, level 1, or level 2, can I use those enzymatic alpha hydroxy pads, especially when there is a lot of scabbiness and redness on the skin?
I tell people not to do that. So initially, they should be using the AOX pads. During all healing protocols, it's AOX-C pads because those are hydrating and antioxidant.
Right.
That's what you want. They should be using the enzyme polish as their wash, but they should not use the pads. The pads are too strong. They would use those pads after they've peeled, typically the week they peeled or the week after.
Great, fantastic. I want to talk about the Illuminating mask. I feel that everyone wants that. I spoke to so many doctors. A lot of doctors, when I talk to them, they say, "Oh, this is like a must-have for my patients." Do you want to just talk about it really quick?
Yeah, I mean, I made this product on purpose. We talked about it a little bit before. I made this on purpose for people to maintain their results. Initially, it was you would use this product starting a week after any treatment, and you would do it weekly with either derma rolling or stamping as an alternative to your retinol at night, because this is like doing a retinol peel at home. But what we found was it illuminated the skin so much, people's skin improved a lot. And because of the marine sea whip, the arbutin-niacinamide, the vitamin C and kojic acid, all brightening agents that really worked to enhance healing and brightening and inflammation, it worked great with treatment. So I recommend that this is a product that's a go-to for everything. You're getting a facial that night, you should be using this mask. You're getting microneedling, they should apply it immediately. You can even needle it into the skin, actually. You're getting a laser. The protocol for laser is typically to do it the night of, day 3 and day 7. The full tube is one treatment. Then you do it every week. Now, some people, if they don't want to use the full tube, that's fine. You may not get as much of a result after a treatment, but you could use a part of the tube, a quarter or half of the tube every few nights as a micro peel, like micro dosing of the treatment, or they can use it as spot treatment over blemishes, acne, or melasma. The ingredients in it work for pigmentation, work for acne, work for fine wrinkles, decrease in redness. And like I said, remember the marine sea whip is really anti-inflammatory, so they could do it after doing a peel or anything like that.
Fantastic, great. I know a lot of patients too, they go, even if they're getting different kind of a treatment that has nothing to do with the brightness, but they kind of grab one of those masks to take home just to double on the benefit of anything. So I want to talk about the Hila B. This is my favorite, and I cannot live without it because I know hyaluronic acid is like equivalent to give your skin 8 glasses of water, right? If you're not...
They say, I mean, no, there's no way to know for sure, but yes, it's very hydrating.
I mean, I do feel it actually. When I put it on, I do feel my skin looks fresher, younger, and so on.
Me too.
So a few questions on this one. We hear that it helps with the lines and wrinkles, right? And it helps to plump in your skin. Is it wise to pick up this product and use it at home prior to have any procedure done to kind of prep your skin to be stronger and more hydrated?
Yeah, I mean, for any treatment we do, you should be prepping anyways. And and the reason I made my line is it has all the main things you need. It has the antioxidants for the AXC. It has the hydration from the Hila B. It has the peptides for cell renewal and collagen production. And then it has your illuminating mask, which has a multitude of products to help you turn the skin cells over, brighten the skin. So you should be technically doing this full line for a week or two before you do any treatment. Your
Right.
skin does better. It's like training for a marathon. You can't just run it. You have to train for it. So you want your skin to be as hydrated as possible. Now, here's the thing that's different though.
Yes.
In the previous product, we had high concentration hyaluronic acid and tamarind seed. Now it has vitamin B, hyaluronic acid, and has a probiotic that's anti-inflammatory.
Amazing.
Probiotics in the gut help for gut regeneration,
Right.
and pro healing bacteria. That's what this one does. It's a type of lactobacillus that helps inflammation, regeneration, and healing. So yes, you're going to get anti-aging effects with the plumping, but the one thing that no hyaluronic acid has is this healing probiotic, which is why it should be used like water when you're using after laser. Like I have patients that do 2-3 of these bottles when they do their face and neck to really calm their skin down, because it makes it heal faster with the lactobacillus. The other thing, guess what? Salicylic acid has a little bit of that product in it to help exfoliate the skin, because remember, what do you need to get collagen production going? You need the skin cells turning over faster. You need it to be more radiant, smoother. You don't want to feel a rough texture on the surface. That's the stratum corneum. You want the skin to feel plump, to look radiant, to look hydrated. You have that when the stratum corneum is gone and the skin cells are turned over. That's why I have people use this up to twice a day. And obviously even more, they should be doing it 2 to 3, 4 times a day when they're doing laser with my hydrating masks, because my hydrating masks have a higher concentration of this to help people and it pushes it into the skin because of the biocellulose. The other thing they should be doing is using this with a roller. So when they do the micro rolling kit, they should be putting this on first, using my ampule that's in the kit, and then rolling on the skin.
Fantastic. You answered my second question. I do want to tell you one thing is from my own experience, and you tell me what do you think of it. Again, because this is my favorite product, I noticed, and I think it's okay, unless you tell me don't do it.
Yeah.
After I do my makeup, I noticed when my skin is dry, I was under the weather or a lot of stress or traveling or so on, I don't feel like enough hydration in my skin. So I take 2 drops of the Hila B and I actually added it under my eye as a concealer. And my skin looked like I upgraded from a regular foundation to first class foundation. So is that okay?
You said that. You can mix it actually with my Fusion Shield SPF and get a very similar result, because the Fusion Shield SPF is an SPF BB cream, which acts more like a foundation. Coming in the works is our mist, and our mist, which will be used perfect. You can put it on before and after your makeup, will give you that look. So at least for right now, what I would tell you is even more of a secret is I would take a drop of AOC and add that too, because the base of AOC is a little more illuminating. It's a little more oily. So it actually will even make the makeup look more dewy.
Yes, no, great. I think I'm doing it the right way. One more thing, I had one of the nurse practitioners, she's in an area where they're not, they cannot afford to buy the full line, although they do love the full line.
Well, that's where I say you do the Dermergency kit.
Yes.
And they add 1 or 2 products with that. You know, so the Dermergency kit has what people need, a little bit of everything. It's got the high spot, it's got the Hila A, it's got our foaming polish, which everyone loves, and is really hydrating on the skin, is great for post-procedure, and has one of the masks. You can add to it for healing, depends. Like if you can only pick a product, I would go the Refit. If you can add a few, I would add a Refit AOC and the Botanical. If they, once they get used to it, then they can go and upgrade their Hila A or their high spot and do more masks over time. But the kit itself is a very good value for what they're going to get.
Yeah, and it kind of like get them to start on a smaller thing and get bigger.
Mhm.
One more question in regard to people working on a budget.
Mhm.
They want to get one or two. Right now, they cannot go too much. With the Hila B, if they mix it with the regular moisturizer, I know our products
That's
are
fine.
designed to be used together. But do you see if one product or two, can they take that Hila B and add it to their moisturizer? With
Yeah, I
still,
mean, my opinion would be I mix it with Refit because they get peptides. But if
correct.
they want just a regular dermal repair cream or a ceramide or triple lipid or something, they could mix that or put it on right first. They should actually micro stamp, put the Hila B on, and then their moisturizer.
That's great, fantastic. Can we, it's talking about our little devices, can we use
Mhm.
it under the eyes as well if I have vitamin C? And so that will be okay.
Yeah.
Um, I think, uh, tell me about your favorite laser that you like. I know I hear a lot
Well,
about that.
that's hard because I have 100 lasers.
No, no, no.
The biggest protocol I do frequently, the ones I do the most, are
Yes,
CO2, halo combinations, and Moxie. Those three. So my line was developed in getting people to heal very quickly from
that,
those.
yeah, you answered my last question. I think it's a great, I love it that anyone can use it from any age, any type of skin. The sunscreen is always what you recommend to follow with. You don't think there is, with the ethnicity of the skin, with the background, they're
No,
for
this is
everyone.
designed for every skin tone.
Is there anything in the product that helps with the ungrowing hair? For
Not really. I mean, the glycolic pads are very good for
that's
that.
what I wanted to
The
first.
AOXC, the base of the AOXC is really good to use even before shaving. So someone can put it on their beard, let it sit for a few minutes, then put their shaving and shave. It'll soften the hairs and make
Correct.
it. And same thing with Hila B. But there's really none. Now, if they were actually doing our illuminating mask weekly or following the Dermergency kit, a lot of those ingrowns would be less because it would soften and get rid of a lot of the acne and exfoliate,
Okay, fantastic. And for,
especially with the enzymatic polish.
yes, that's what I thought. Anything with salicylic acid and with the enzymatic. And then when it comes to the neck, one of the advice I gave to the patient, because we don't get as much plumpness as we get on the face. So I did say the Hila B, the Hila A, and the Refit plus the AOXC, which I mix it for all the cocktail, is the best thing for the décolleté area. Correct?
Mhm. Yes.
Okay. I think I got a lot of information. Thank you so much, Doctor.
Good. Okay, well, that's perfect. So we
Very
use that as part of our Emer protocol training. You could send it to the teams, Jordan, as well, or
Yeah,
Ferry.
I'll
You
download
guys
it.
can
I'll drop
organize,
to the
but
video
add it to
for
the
you guys.
link and let the people know that carry the line that this is in there so they can watch it.
fantastic. I appreciate it, Doctor. Thank you for your time. I hope
Got
you
it.
liked all the question.
No, everything was great. I'll
Okay,
talk to you soon.
sure. Okay,
Bye.